From aviation to health matters now, the federal government has emphasized that the newly detected XEC COVID-19 variant identified in Australia and some other countries in Europe is not in Nigeria. The Ministry of Health and Social Welfare, which made the confirmation, explained that a recently leaked letter addressed to the Committee of Chief Medical Directors was precautionary and not intended to cause panic. In the letter dated December the 5th, the Federal Ministry of Health and Social Welfare had asked health authorities to activate heightened alert systems across hospitals and maintain a high index of suspicion for patients with COVID-like symptoms. It also called for collaboration with relevant stakeholders to share critical data regarding the variant and implement enhanced monitoring protocols. Meanwhile, outside our shores, Nigeria's coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, says trillions of dollars in stimulus money spent by world leaders during the COVID-19 pandemic proves that global resources are available for intervention. But that is now needed in form of preventive and proactive investments in global health security. Professor Ali Pate informed the forum in Doha, Qatar, that President Bola Tinubu, who serves as the African Union's champion for health, is implementing a comprehensive reform of the sector that is harmonizing health policies and programs of subnational governments with the federal government's reform initiative. He made this known as he represented Nigeria's strategic blueprint for the sector before an audience of global leaders at the Doha Forum today.
Domestic financing had not been, let's say, allocatively very efficient. It had focused on higher-end care, which was not as efficient, to reorienting towards primary health care and expanding the functionality of the primary health care system is at the core of the President's renewed hope agenda, the Health Sector Renewal Investment Initiative, to expand the functionality of the primary health care system, to prevent diseases, but also to deal with them very early on before they get complicated, and to expand the infrastructure, the human resources and services by making sure that population are able to afford that. So expanding the vulnerable groups fund so that we use the resources that we have and use it well. And in an era where we are interdependent and interconnected, it's really a silly game to think that we can be in isolation. Guaranteeing basic access for everyone, investing towards that actually is in everyone's enlightened self-interest. So there are resources. The only thing we lack is the political will. If you think about conflict and the cost of war, we have not talked about the dividend of peace. And how can that be channeled to investing in our common humanity?